Good day, ma'am. I am Lenny Grace Mbane from the SN3B. Today I'm going to perform inserting nasogastric tube. The purposes of this one is to administer tube feedings and medications to clients unable to eat by mouth or swallow a sufficient diet without aspirating food or fluids into the lungs. It is also to establish a means for suctioning stomach contents to prevent gastric distension, nausea, and vomiting. It is also to remove stomach contents for laboratory analysis and to lavage or wash the stomach in case of poisoning or overdose of medication.
Let's start! Assessment. Check physician's order for insertion of nasogastric tube. Check for history of nasal surgery or deviated septum. Assess patency of nares. Determine presence of gag reflex. Assess mental status or ability to participate in the procedure. Planning. Identify the availability of needed supplies and equipment. Arrange for extra nursing personnel to help as necessary. Prepares equipment and brings preparation to the bedside.
Good afternoon, sir. Sir, ako day si Lenny Grace Banoy, yung nurse karon. Karon, sir, mag-perform ko og inserting nasogastric tube in GT. So, isubsub na ko na siya sa imong ilong, sir, no? Then, nalang ko yung mga ipabuhat sa imong unya during insertion.
Implementation. Greet client, introduce self, and explains procedure in the client's level of understanding.
Sir, unsay imong pangalan, sir?
Yes, ganyan kagama po.
Identify client using at least 2 identifiers. Provide well-lighted room. Provide privacy by screening and closing windows and doors. Assist the client to a high faller's position if his or her health condition permits, and support the head on a pillow. Place a towel or disposable pad across the chest. Apply clean gloves. Ask the client to hyperextend the head and using a flashlight, observe the intactness of the tissue of the nostrils, including any irritations or abrasions. Examine the nares for any obstruction or deformities by asking the client to breathe through one nostril while occluding the other. Prepare the tube. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the xiphoid. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Insert the tube with its natural curve downward into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube toward the nasopharynx. Direct the tube along the floor of the nostril and toward the midline. Slight pressure and a twisting motion are sometimes required to pass the tube into the nasopharynx, and some clients' eyes may water at this point. If the tube meets resistance, withdraw it, relubricate it, and insert it in the other nostril. Once the tube reaches the oropharynx, the client will feel the tube in the throat and may gag and retch. Ask the client to tilt the head forward and encourage the client to drink and swallow. If the client gags, stop pausing the tube momentarily. Have the client rest, take a few breaths, and take sips of water to calm the gag reflex. Ascertain correct placement of the tube. Aspirate stomach contents. And check the pH, which should be acidic. Secure the tube by taping it to the bridge of the client's nose. If the client has oily skin, wipe the nose first with alcohol to defat the skin. Apply a commercial securement device. Cut 7.5 cm of tape and split it lengthwise at one end, leaving a 2.5 cm tab at the end. Place the tape over the bridge of the client's nose and bring the split ends either under and around the tubing or under the tubing and back up over the nose. Once correct position has been determined, attach the tube to a suction source or feeding apparatus as ordered, or clamp the end of the tubing. Secure the tube to the client's gown. Loop an elastic band around the end of the tubing and attach the elastic band to the gown with a safety pin. Or, attach a piece of adhesive tape to the tube and pin the tape to the gown. Remove and discard gloves. Perform hand hygiene. Document relevant information, the insertion of the tube, the means by which correct placement was determined, and the client responses, example, discomfort or abdominal distension.